Okay, I have 10 o'clock, so we're going to go ahead and get started. I just pressed record. As a reminder, this will be available in its entirety shortly after the briefing. I am going to go ahead and turn it over to our Public Health Officer, Dr. Olivia Kasrye.
Good morning, everyone, and thank you again for joining us. So I'll start off with a summary of the numbers where we're at. So as of this morning, we have 110,781 cases of COVID-19 reported to Sacramento County and 1,758 deaths. We are now averaging about 164 additional cases per day, and our case rate as of this morning is 10.4 per 100,000. You've probably noticed that over the last few days, there has been quite a steep increase in the case rate. We started off the week at 8 per 100,000, that went to 9, and then yesterday went to 10 per 100,000. And because of that increase in cases and because of concerns about the Delta variant, we have issued a press release with a recommendation to the public that for people that are vaccinated, that in indoor settings where there is no process for verification of vaccination, that they wear masks. The CDPH guidance, masking guidance already requires people that are not vaccinated to wear masks or face coverings indoors. And there are some settings such as schools, jails, in public transportation, where people are required to continue to wear face coverings. So this is just an additional recommendation, especially as we're continuing to see our case rate going up. But of course, it is important to note that our way out of this is with vaccination, because the majority of the cases that we're getting are among people that are vaccinated. So we're continuing with our efforts to get people vaccinated, especially focusing on the zip codes and neighborhoods where we're still seeing relatively low vaccination rates. With that, I'll turn it over to Jamie.
Hi, good morning. So I'm going to go ahead and give a brief update about our breakthrough cases and then also some unvaccinated hotspots in the county. In terms of our breakthrough cases, as of yesterday, we've had a total of 262 breakthrough cases that were symptomatic, 26 of which were variant cases. 10 of those 26 were typed as the Delta variant. Among these breakthrough cases were 19 hospitalized patients, and 6 of the 19 came back as variants, one of which was Delta. There were 3 COVID deaths among these breakthrough cases, none of which resulted in a variant. In terms of unvaccinated hotspots, the northern part of the county has the lowest vaccination rate. So specifically Rio Linda, North Highlands, and Citrus Heights are the most unvaccinated areas of the county. That's all I have. I'll go ahead and turn it over to Nick Morey.
Good morning, everyone. Nick Morey, I'm a member of our schools team. We've been interfacing with schools for the better part of the last 18 months with guidance on COVID-19. As I'm sure many of you are aware, last week, CDC issued updated K-12 schools guidance, and a primary component of that guidance was the recommendation that schools maintain 3 feet physical distancing in the classroom setting, with the caveat that if they're unable to do so, they need to rely heavily on other layers of protection, primarily masks. And with that, CDPH earlier this week issued updated K-12 guidance in alignment with that, noting the priority is to get as many kids back in the classroom for in-person instruction as possible. Also acknowledging that maintaining 3 feet of physical distancing would likely make it impossible for many schools to bring all kids back into the classroom. CDPH also noting that vaccination rates for, the large majority of K-12 students are unvaccinated because, of course, under 12 are not eligible yet, and vaccination rates for 12 through 18 are still relatively low. CDPH has issued guidance that does require mask usage in indoor settings and schools for all students K-12. We've shared this guidance with schools, and we continue to provide guidance and technical assistance for them as they prepare for the new school year. I'll turn it back over to Janna.
Thank you. So that is our briefing, and we will go ahead and open it up to questions. There are a lot of you in here today, so please either utilize the raise your hand feature or chat feature if you have a question, and I'll go ahead and start with Brandy Cummings.
Hi, good morning. I have several questions. First, a point of clarification. Dr. Kasrye, I heard you say that the cases were among people that were vaccinated. Was that the cases that you are now seeing are people that are not vaccinated?
I said that most of the cases that we're getting are among unvaccinated. In other words, not vaccinated.
Okay, I may have misheard you. Thank you for clarifying that.
Sure.
The other question I had, LA County has 61% fully vaccinated and has had indoor mask recommendations since the end of June, yet they also had a surge. Sacramento County has about 45% fully vaccinated, less than half. Should the county have been more aggressive with the mask recommendations prior to now?
I'm sorry, could you repeat the question?
Sure. Should Sacramento County have been more aggressive with the recommendations for wearing masks in places where vaccination status does not have to be proven?
I think it's important for us to remember that the most important thing that we can do right now to get us out of the current surge is vaccination. So in Sacramento County, that has been our focus. And of course, we have had discussions about masking, but it's only up to this week when we started seeing a sharp increase in cases that we reassessed that. And that's the reason for putting out the recommendation for masking indoors.
And speaking of those increasing cases, we've reported that there was an expected increase because of the reopening. Was this number what you expected, or do you expect there to even be a greater increase in the number of cases?
Well, it's hard to know, but we are trying everything that we can to make sure that we slow down the spread. And so the messages we're putting out, if you're sick, if you have any symptoms, please stay home. And then also masking and also being careful in large gatherings. And also, again, the most important message is that if you're not vaccinated, please get vaccinated. We are hoping that we will be able to bend the curve quickly, because that's what we really want to do, is get to that plateau and start seeing a reduction in cases. So it's hard to say how long it's going to take us, but we are definitely working hard to get out there and get people vaccinated, and also get the message out about how people can keep themselves safe.
Sure, but let me ask it a different way. So when there was news that the county and the state was reopening, obviously many health experts have said that there was an increase of cases to be expected. Based on your knowledge of, the county and what was to be expected, what did you expect? What numbers did you expect to see go up as the state and the county reopened?
What we expected was that there'd be a little bit of an increase in cases, and then a small increase, maybe 1 or 2 percentage points in increase in the case rate. But what we're seeing now is that the numbers are continuing to climb. And again, our concern is with the increase in the number of cases that are sequenced to be the Delta variant. And as we know, the Delta variant is more contagious. And so there is concern that we might be seeing a further increase in our cases.
And what is the concern that this increase in cases could lead to businesses having to be shut down again, or there to be more travel restrictions throughout the county?
At this point, there is no consideration of that. One is that we do have a substantial number of our population vaccinated. And when you look on our dashboard, if you look at the map, especially for the last 30 days, you will see that the number of affected zip codes with high case numbers has reduced. It's just that we do have these hotspots, and they tend to overlay with the areas that have low vaccination rates. So that points to what we need to do, which is to continue with the vaccination, because once we are able to do that, we expect that the case rates will begin to go down.
And what's
I'm
the
going to
reason?
jump in here, Brandy, and we have a lot of questions. So I'm going to go ahead and move on to Michael, please.
Yeah, thanks. This is Mike at the Sacramento Bee. I also have a few different questions. One of them is that what does Dr. K touched on this a moment ago, but does the county have any specific plan in the works for if the numbers continue to escalate as far as will we see more measures in place if we go from 10 to 15 cases per 100,000 or 15 to 20 and so on? My second question is, we 7 weeks ago or so, whenever it was, there seemed to be a lot of optimism about reopening, but there was also a caveat that we would have to keep a close eye on variants. But the sense I'm getting right now from SAC and a lot of other counties is that we don't really have a great sense of how widespread the Delta variant is exactly because of some lab limitations. So my second question is, how can we arrive at the appropriate level of response when that still seems to be a big unknown?
So your first question was about if we're going to take additional measures. Right now, our expectation is that the measures we are taking are effective, and we just need to continue with, especially with getting people vaccinated. Of course, we are in discussion with the state, and the state is monitoring the case rates, not just in Sacramento County, but all over the state. So definitely there are ongoing discussions, but what I can tell you is at this point, there are no considerations of additional steps. And as for the sequencing, the lab testing that we're doing right now is mainly for surveillance. And so it's not really for meant for us to it gives us an idea of what variants are circulating in the community, but at this point, the lab capacity does not allow us to be able to do it for every single case that we get. But the information that we're getting is sufficient for us to be able to make decisions. And we know that with the cases that are being sequenced, that the Delta variant is a larger and larger proportion. So we are aware that it is becoming the predominant variant in the community. We also fortunately have a Yolo County that has a lab that is doing sequencing for all of their cases. So that also helps us in having an idea of what is happening within the region.
And I'll add, I'll reiterate that Dr. Kasrye said earlier about our primary strategy in terms of the response being vaccinations. And right now we're doing between 20 and 25 pop-up vaccinations a week. So our team is really working hard to get the vaccine out into all the areas of the community throughout the county every week. And then in addition to that, we do also have other response strategies when it comes to specifically outbreaks. For example, our communicable disease teams do contact tracing, they do case investigation, they put people in isolation or quarantine for the appropriate amounts of times. They provide education and infection control prevention practices. So all of those strategies are still in use and are still relevant now. And I would also add that even against the Delta variant and other variants, the vaccination is really the best way to protect yourself.
So relating to the vaccinations and the pop-up vaccine clinics, are these pop-up clinics successful in terms of the amount of people that are, the pace at which people are getting vaccinated? And is there room for the county to be more aggressive in other areas, not just clinics, but in terms of public information or other outreach like that?
So I guess it's relative in terms of what a successful vaccination clinic looks like, right? So we're not seeing the thousands a day that we were seeing early on when the vaccine was first released. But to us, anywhere between, even a single vaccine is a success, right? That's one more person. We're seeing about an average of between 20 and 100 at all of our individual pop-up sites. And we still continue to see even like 500 a week out at our stationary drive-through place in Cal Expo with our partner Curative. And yes, we have been strategizing on ways to be more aggressive. We're trying to leverage even additional resources. We're requesting additional resources from the state for mobile sites.
I'm going to go ahead and move on to Renee Santos.
Hi, good morning. I just have two quick questions. We know yesterday neighboring Yolo County issued their press release regarding, encouraging people, even though they're fully vaccinated, to wear masks. I want to read a part that really stuck out to me in their release. It says, although vaccine breakthroughs with the Delta variant in Yolo are rare, preliminary evidence suggests that affected persons may be able to transmit the virus to others even when they have no symptoms. So essentially, this is saying that fully vaccinated people can be infecting others in the community. Is that what we're seeing in Sacramento County right now?
We can't say that for sure, but I think it's really erring on the side of caution in terms of, we do know that the vaccines are effective, but they're at maybe 80 to 90% effective. So there is still that chance that maybe somebody, and we know that we have had the breakthrough cases. So there are chances that somebody might be infected and still be able to transmit it to others, even if they themselves get either mild disease or get no symptoms at all.
What are the ramifications of that, especially when we're seeing this surge happening right now and the likelihood of those restrictions coming back?
I think I want to emphasize again that the vaccines are very effective, and most of the cases that we're seeing are among people that are unvaccinated. So in terms of what we need to do is to continue with the vaccination. As far as ramifications, I think we're seeing that right now where we are getting a surge in cases. And of course, our concern is that when the transmission in the community is high, it does increase the risk for everybody. So that's why it's really, really important for us to continue with the vaccinations and reverse the direction of the case rates.
When you say everybody, Dr. K, just to clarify, that means people vaccinated and not vaccinated. Is that what you're referencing?
Yes.
Okay, next up I have Sammy.
Yeah, I wanted to ask, with the testing rates being as low as they are in Sacramento County, how conservative is the case rate we have currently?
It's as good as the information that we have right now. We, of course, continue to encourage people to get tested. We do have 10 of our community test sites. They're still active. And the staff that from the community that are at those sites do go out to provide education and also help people who need additional resources. And so we're doing the best that we can right now. We do recognize that there has been a drop in testing, but we are our goal is to make sure that the testing is readily available for people that need it.
Thank you. One more question. What are we seeing in terms of hospitalizations, and how impacted do you see ICUs becoming given the current rise?
Well, this past week is when we started seeing an increase in the hospitalization. This week, our numbers went above 100. And so we're closely monitoring that. We are in communication with the hospitals. Right now, we are not seeing an impact on the hospitals. They're still able to handle the cases that they're getting, but that's something that we are continuing to monitor.
Okay, next up, I have Lena.
Hi there. I have two questions for you. My first question, I'm wondering, why should fully vaccinated people take this guidance from Sacramento County today seriously?
Actually, even prior to us putting this guidance out, a lot of people chose to continue wearing face coverings, especially in public places, especially in places where you had mixed groups. So this is just an encouragement to others who were considering it, that it's something that something additional that they can do to help.
Okay. And my second question for you, if you're familiar with it, I'm wondering, do you agree with the Surgeon General's advisory that misinformation is an urgent threat to public health?
It's definitely made our work more difficult because oftentimes when we're going out to provide education about vaccination, these are the questions that we're getting are usually information that people are getting from social media that is inaccurate. So we have to be out there constantly trying to correct the information and making sure that people have accurate information in order to make the right decisions.
Thank you.
Boyd, I had you up next, but your hand went down. Do you have a question?
No, I just took it down so I don't forget. Thank you.
Okay. Then it looks like, oh, go ahead.
I have two questions. So your messaging today is very, there's a lot of emphasis on encouraging vaccinations. That's our only defense against the virus. But does the county have any specific strategies in mind, or are you working on strategies to address the situation if our vaccination rates continue to be low? So if folks don't heed your messaging and we stay below 50%, are there any strategies for that? That's my first question.
Well, we're continuing to work with trusted messengers. We have collaborated with a lot of community-based agencies, and some of them have actually received additional training as what we call vaccine ambassadors, so that they're actually actively going out in the community with the accurate information to make sure that they answer people's questions, especially dispelling some of the myths, and also correcting misinformation that is out there. So I think that is our key to being able to reach the people that we need to reach right now. And also with the pop-up clinics, being able to take the vaccine to where people are, and also trying to be innovative. Recently, some of our staff went to an event that Animal Control had, where they were offering rabies vaccinations to pets. And so our staff were there to provide vaccinations for the owners of those pets. And so looking for innovative ways like that, or sites, we've been putting out the word to businesses and encouraging them that if they would like us to come to their business and put on a vaccination clinic, that we're able to do that.
Mm-hmm.
So in as many ways as we can, we're trying to get the message out and also make the vaccinations available.
So I guess you didn't understand my question. I understand that that effort's going on, but for example, in the Thomas, we've had a pop-up clinic and they were not able to fill all those appointments. It does seem that there continues to be this resistance to getting vaccinated. And so my question was more about what are the strategies to address that resistance to getting vaccinated, aside from continuing to offer this outreach. And there might not be an answer to that in terms of an actual plan for the county health department. It seems the masking recommendation might be one way to address that. Just wondering if there are any other plans to address that. And then my second question is, last week and also today, you discussed that the state is only sequencing a small portion of the COVID tests for variants. Is the county extrapolating from that data as to some percentages, or have an idea overall what percentages those variants account for the cases that we are seeing here?
As far as strategies, as I mentioned, we are using trusted messengers. We are collaborating with community-based agencies that provide services. And so what we have learned is that a lot of people, it depends on who's providing that information and the message to them. So being able to work with the trusted messengers, I think, is a great way for us to get the message out and to encourage people to get vaccinated. And as for the sequencing, as I mentioned, I think that with the tests that are being done, it gives us a very good idea of what is happening in our county as well as in the region. And I also mentioned that Yolo County does have the capacity, and they're doing sequencing for all of their specimens. And so that provides us additional information as well. And from what they have shared, we know that the Delta variant is now the predominant variant in the region.
So are there any percentages associated with that? Like 90% of the new cases are variant cases, or 50%, or?
I don't have the YOLO data in front of me, so I'll have to get back to you on that.
Okay.
I would also add that the cases that we're prioritizing for at the state level, they're doing outbreak cases, hospitalizations, and cases among vaccinated persons. And so if you try to extrapolate those data to the county overall, it's going to paint a more grim picture than probably what we're seeing. So.
Okay, it looks like I have a second round of questioning from Brandy and Michael. In the interest of time, I'll limit you guys to one more question each. So Brandy, go ahead.
Yes, thank you. And I appreciate you guys having this today. One last question. We heard through the briefing that the northern part of the county, Rio Linda, North Highlands, Citrus Heights, had the highest unvaccinated population. Why do you believe that's the case?
It's hard to say. I think that there are multiple factors. One that we know of is that for many of the individuals, they may have barriers that are preventing them from being able to come for the clinics that we have provided. And so that's why it's important to get the pop-up clinics out there. I think the misinformation on social media plays a role as well, especially for the young adults where our vaccination rates are not very good. What we're hearing is oftentimes they're just repeating information that they've heard from a video or something they've seen on social media, which might not be accurate. And so being able to get to those people and provide the accurate information, I think, is important.
Okay, Michael, go ahead.
Yeah, so my question is, when CDPH's blueprint was kind of winding down, Sacramento was one of, I think, the last few counties still in that red tier, meaning our case rate was higher than much of the state. Do you think that the fast increase you're seeing now is linked at all to the fact that we did go into June 15th with a relatively high baseline of cases compared to the rest of the state?
I think that what we're seeing is a result of the spread due to the Delta variant. especially in the last week with the increase in the cases.
Okay, and then Sammy has one more question as well.
I wanted to ask about verification of immunization. Does the county have guidelines on how businesses should verify, or are there plans to put out guidelines on that?
The state does provide that in the masking guidance that they have, and businesses are able to use one of three ways. They can either request for a copy of the vaccination card, or it could be by self-attestation, or they can use the new system that the state has set up where individuals are able to get their verification online, and so are able to use a QR code.
Okay, it is 10:31. So I will go ahead and close it there. As a reminder, this entire recording will be sent out probably within an hour. We will also be posting a link to it on our COVID-19 webpage. And as with the last few weeks, we will assess the need for these briefings on a week-by-week basis. And if we are going to hold one each Thursday, you will get an invitation for it Wednesday morning. So thank you guys for joining us today.